My main practice is adolescent medicine, but I did family practice as a way to get to that. And so I see adults and I supervise in the clinic. We teach family medicine residents. So so I see a lot of adult patients with them as well. And I was taking parents of my patients for a while, but the patients grow up and move off, the younger patients, but the parents stay with me. So too many adults, I have to limit it now to just kids, because that's the area that I work in more often, or see most of my patients with and have my specialty in. So we're going to talk about adult ADHD though, and living with it, because everyone who's an adolescent does grow up to be an adult, usually, if they survive, and that is a problem sometimes, but we'll talk about what it's from first of all, then and what it's like, and then what we can do about it. So first of all, the core symptoms have been known for a long time. Inattentiveness is the main one, impulse control, and hyperactivity. And those are things that you can usually identify with. But how it looks, it can be different. It's made up of a bunch of different functional units in the brain. And one of the, what we have through PET scan studies, which don't project too well on this, for this talk, but we've done various different neuroimaging studies that show that parts of the brain are not turned on with ADHD. Yes? I'll try to speak louder. I'm not sure if I can get it loud enough, but without losing my voice. But there are parts of the brain that are not turned on with ADHD, and they provide the symptoms. That's what gives you the symptoms. So one of them is distractibility filter. There's an actual part of the brain that filters out and prioritizes input of information. So when you hear buzzing lights or shuffling feet in a room, or cars outside, or birds singing outside, then you're going to filter those out and just listen to what's important. But if you have ADHD, you don't have that filter turned on, so you don't get to filter those things out. So everything is distracting. Task persistence is another difficulty with ADHD, and what you'll have is you start off on a task, but that system that helps you to remember to stay on task is not turned on. So you don't get it's actually an urge. It's been shown with a different type of imaging called PET, the ultrapain PET scanning, SPECT scanning. And you can see the bump every few seconds if it's turned on. If it's not turned on, then you don't get a reminder to stay on track. So you might start off on a task, and then you get distracted, and you get to, go off on another tangent, and then you get off on another task, and you might work your way around to the original one eventually, or maybe not. So that causes difficulty with getting tasks done. And also procrastination can be part of that reminder system, because you say, oh, I'll do that in a few minutes, but then you don't get that reminder to get back onto it. And then inattentive errors while driving. You look away from the road, and you don't get another signal or urge to get back on the highway for quite a while, or to get your eyes back to the road situation for quite a while. It could be minutes, could be days, could be, never. So that's another one. Then the memory organization function is also an important one. And part of that is working memory. Working memory is not really a file system so much as it is a post-it note system. So I've got an appointment, let's say, with somebody next Friday to check my eyes. Okay, I've got a post-it note there somewhere in my brain, in my working memory, and I put it there, and then I go off and do some other things. Water goes under the bridge, and first thing you know, Friday comes by, and I have missed my appointment because I never saw the post-it note again. It kind of disappeared. It blended in with everything else. So that's another working memory problem is what causes that. Another working memory, the other type of memory, is more long-term memory. And long-term memory is when you learn a piece of information in long-term memory, it's like you write it on a sheet of paper in your brain. So you're writing that information in your brain. And then if that system is turned on, you get a file cabinet system with file folders, A, B, C, D, and so on, math, history, English, spelling for students, or whatever. And you can put that information in the file cabinet, and then you can retrieve it when you need to. If it's not turned on, you get a cardboard box. All the sheets of paper go in the box at random. when you go to look for that information, you've got to look through all the sheets of paper. And if anyone's ever looked through a stack of papers looking for one paper, it's pretty tough. So you end up not being able to find what you need. Now, for someone taking a test, they will find the piece of paper eventually sometimes, but it might be later this evening, tomorrow, next week. It's not going to be right away, oftentimes. So they're very inefficient. It's not a good way to store things. You want to have it organized, and that's helpful. So those are some of the big ones. Now, how does it, you hear a lot about ADHD is overdiagnosed, overtreated, whatever, in children, but our research doesn't show that. It actually shows that we're still undertreating to some extent, to a large extent in most places. We may be a little closer to getting it here, but still not. We still a lot of kids go untreated. But what they used to say is that you'll have maybe just a small percentage. They used to say no one went into adulthood. I remember my first pediatric clinic 30-something years ago, or 30 years ago, where this one boy turned 13, and the pediatrician said, "Well, this is the last time you can be treated for ADHD." Because he had his birthday, so he wasn't going to be treated anymore. And I didn't stay in that situation long enough to see, but a few years later, when I did my fellowship in adolescent medicine, I had a 14-year-old who had been told that about 8 months before, and he was doing terrible in school. So we started him back on his medication, which was like, it's like sacrilege, because everyone knew that at 13, it disappears, okay? Well, we put him back on his medicine. He'd always been a straight A student, had always been a really good student and everything, really good, well-behaved and everything, very nice kid. Put him back on his medicine, went back to straight A's, okay? He did really well. And I followed him for 3 years, and he did really well the whole 3 years, okay? So it doesn't really go away. A lot of times between 11 and 15, this particular one that I just said was never hyperactive, but if they were hyperactive, a lot of times they'll become either normally active or underactive. And a lot of adults who have ADHD actually find it hard to get up and get moving. They actually find it, some of them are just flat sleepy, just plain sleepy, and stay sleepy all day long. And some of them are not really sleepy, they may think about cutting the grass, and that's all that happens. They think about it, and the switch that gets them up out of the chair to go cut the grass doesn't turn on. So that's something we call executive function, or that's part of executive function, where you can actually execute what you think you'd like to do, okay? And not everyone has trouble with that, but a lot of adults do. But at 11 to 15 years, a lot of the overactivity and impulsiveness goes away, and that's why people thought that the whole ADHD condition went away, but it really doesn't. Adults continue to have the difficulty with attention span and with memory organization and with persevering on a task, and they continue to have that problem throughout adulthood. The majority do. Those who actually don't persist into adolescence and adulthood are probably those who have some other condition. So they're classified as something else rather than just not having anything. There are some guys and girls who, as they get into their later teenage years, find a career where they don't have to do paperwork and they can just be creative or just be active, working with their hands or whatever, and may do just fine without treatment. But most people, or they can find a spouse that's able to do the paperwork for them, or a secretary or someone like that, and it may work out. But the majority of people will continue to have difficulty with it throughout their life. But the impulsiveness, and use the word impulsiveness, that means acting before you think. For a lot of people, their impulsiveness is mental, and they just think off on a tangent. But for some people, it actually gets to their mouth. And then they may have a thought, and it pops out of their mouth before they've decided whether it's a good idea or not. And that ends up getting you into trouble with your spouse or with your friends, children, whoever, because you just pop out, coworkers. All right, but it becomes more intermittent, where it's not happening all the time, but it happens often enough to give you trouble. Then the inattentiveness is the one that continues to be a big problem for the entire life. Now, how heritable is ADHD? It's very heritable, okay? So that you have a 75 or 80% heritability. That is probably, blue eyes, brown eyes, things like that. They're about the same heritability as that. So it's really, it's a different system. We used to think that we would have one gene system that would, code for the inheritance of ADHD. It's at least 35 of them, and maybe more than that. Because as we go, we're finding a lot of there's lots of different systems that are involved. I was hoping it would be just a few, because then we might be able to target treatments to those few, and that would be a lot easier to deal with. But the genetics are just much more complex than we thought. It is, on the other hand, with a lot of the ability to do neuroimaging studies and things like that, and look at neurotransmitter systems and structural differences, we're able to, they're targeting some potential treatments now that we hadn't even thought about before. So that maybe end up being a plus still. And they're rarely, what we see more symptomatic ADHD, I think, now than we have seen before. It doesn't mean it wasn't there. In the only population study, which there's actually a slide later, but I'll mention this now, the only population study where they looked at everyone in the population below 18 years of age, they found 16% of the population had or met ADHD criteria, except for the one that says you have to be significantly impaired. Okay, and the reason they left that one out is because a lot of these, of the 16%, a lot of them were no longer in school. They were no longer doing anything that required much concentration, so they weren't significantly impaired in that way, but they had all the other symptoms. What turns someone who has a mild form of it to someone who is symptomatic? It's probably a number of things. One is the challenge that you're facing. I taught in a medical school in Alabama at Birmingham, and we had third and fourth year students, which in the third and fourth year you have to learn all the book work, but you also have to do all the clinical. You have to remember patients' lab work, how tall they are, different things like that, and whether they had surgery or not, or whether they'd been in the hospital before. You have to remember all those things, and that complexity was more, if someone had this much concentration, but that kind of complexity took this much concentration to deal with, they started doing poorly. And in those days, before adults were really being treated, we were treating older teenagers a little bit, but adults hadn't really were just at the verge of beginning to be treated. They just dropped out, the majority of them. They couldn't go on, which was kind of a shame, because a lot of them were very intelligent, very good people, very would have made excellent doctors, but they could not handle the complexity of it without more concentration. So increased complexity will cause you to be more symptomatic. Also, increased stress. If someone has lots of different things going on, they're playing, they're in 5 clubs, and they're playing 3 sports, and they're taking piano lessons or whatever, and they're doing this and that. They're doing just so many things. Then we may see them have a lot more symptomatic, ADHD problems. But on the other hand, there can be other stresses too. It can be like if you have a chaotic family situation where the family doesn't have any kind of structure, no routines, which some ADHD families are hyper-structured, because they know if they don't do that, they'll be very symptomatic. And some, it's very highly heritable, so parents will have difficulties making a structured household sometimes, and unless they have that ability to hyper-focus on structure, which is really helpful. But if they are kind of chaotic, then the household will be chaotic, and then they'll be more symptomatic. Okay? So we see more symptomatic ADHD, plus just the stresses of our culture. There's just so many different things. And now with cell phones, iPads, iPods, all, computers, there's just so many distractions that we have, and with the cell phones, you can't get away from them. And the kids are, talking to 3 people, texting the people next to them, and it's amazing. Yeah. The other things the other causes for ADHD is you can have acquired ADHD, and that's where if you have for adults, it can be head injury, and it can be strokes. That can give you something like an ADHD picture. And And then you can have hypoxic brain injury. That's where if you had a heart attack or something like that where your blood flow didn't go for a little bit, you can lose a little bit of concentrating ability too. And then sometimes you can have both. Who are the people who are going to have head injuries more than anybody else? The people who don't watch out for themselves as well, which are the ADHD, hyperactive, and impulsive people. About probably 10% of people continue to have the hyperactivity and impulsiveness through adulthood. You know, so I've seen some hyperactive older people, as you know, but they're not nearly as common. All right, so these are some of the things I've mentioned already, but there are lots of different physical. That we see ADHD as a more physical thing. It used to be seen as more of a psychological thing, as how you approach life. It's really not. It's more of a hardwired situation, it appears to be. You know, that's why people don't grow out of it. They don't. They may mature. The brain may mature, and they may have capabilities to deal with it better as they get older. But the core symptom of symptoms of distractibility, inability to maintain their organization of their memory, and their inability to stay focused will tend not to change that much through their lifespan.
Does CAT scan show anything?
There are, you said it's CAT scan?
Yeah.
Yeah, CAT scan doesn't show anything. Functional MRI does show things, but we don't have the type of software to read it yet that's reliable. There's a bunch of different methods of diagnosis that have been or have been near the phase 1 clinical trials, and there have been a couple that get to phase 2 for FDA approval for diagnosis. Only one has made it through, and it's not that helpful. I'll tell you about that one in a few minutes. But the MRI that we have here in Lake Charles could be used if we have the proper software, but there's a lot of different software that's being developed, and it's going to take having something that's that's going to be diagnostic enough to be worthwhile, and probably just one instead of a whole bunch of different ones going out at the same time. You know.
My husband just had to have a CAT scan.
Yeah, that won't show it, and a regular MRI won't show it either. And we have a PET scanner in Lake Charles, but it's the several $1 million variety as opposed to the $100 million variety. The $100 million variety is still not totally diagnostic, but it's pretty close. But it's really they're not. It's so expensive they're not going to be able to do that one. That's not going to work for the general population. So it's just used for research. There are only 2 of them in the country, and they're both being used full time for various different types of research. And they do show marked difference between the ADHD brain and the non-ADHD brain. And they also show that when you treat the ADHD brain, it looks almost exactly like the one that doesn't have ADHD, because it turns on those areas of the brain. When I was in medicine, beginning in medicine, we didn't know why the stimulants worked, because they seemed to calm kids down. So a lot of people thought they were calming medicines, but they're stimulants. So how does that work? Well, the stimulants turn on those areas that are not turned on, those functional areas of the brain that help regulate things like your attention and your focus, and they regulate your ability to store memory, and they regulate your ability to filter out distractions, and they regulate or turn on that ability to be reminded to stay on the task until you finish it. And that's why they work. In fact, when I was beginning in medicine, they said that if you gave a stimulant to an adult, it would work the opposite. Instead of making them focus, it would make them more hyper. Okay? I never did find any research. I've written now 4 chapters for different textbooks and things. I've never found any research as far back as 1920s, the modern era of stimulant treatment. I've never found anything to support that. I'm not sure how that got started. But that was the going thing then. That was the dogma of that time period. But they work the same in adults as they do in kids. It's just that adults don't often need the hyperactivity treatment, so it's going to be more, it's going to help their focus more than anything else. But it doesn't make them hyper.
For an adult that doesn't have the stimulant?
Well, there are, and we'll get to that too, but things like Strattera and things like that can work for them too. All right, let's see. Yeah, so now the neuroimaging used to just be imaging. Now it's more like they've bonded imaging with actual neurotransmitter systems. So they can actually do things that highlight a whole neurotransmitter system And now they're breaking it down to not just that system, but components of that system. And the research has really taken off. It seems like there's 15 or 20 new reports of different neurotransmitter domains, networks, and circuits. These are all ways to talk about the different functional areas and sub-areas of the brain that relate to ADHD and other things too, but ADHD research is really ballooning out. So how is it diagnosed for adults? Well, we use questionnaires sometimes. These are, I put these two kind of to begin with because these are two that you can, and I apologize for the really long, I tried to find some way to get these, but if you put in the title of it, and do y'all have a handout with that has that in it? Okay, so you've got it there too. So you can either search, Google search it, and you can print out the ADHD RS, which is free, and you can make as many copies as you want of that. That one you have to score yourself. So this particular one gives you how to score it. Some of them don't, but and then the second one, the Jasper Goldberg, will actually there's lots of different places you can find it online, but it'll actually, most of them will let you fill it out online, and they'll actually give you a score if you press the last button that says score it. You know, and then they're not perfect. They don't make the diagnosis. They just they will say something like, yes, it's probable that you have ADHD, okay? Because the diagnosis is not made through questionnaires, and a lot of people will come and say, well, I want to be tested for it. Okay, well, there's not really a, quote, test in that way. What ADHD, the way to make the diagnosis, the gold standard, is by getting a very good history from someone and looking at their productivity, the way that their brain works over time. Okay, and that's the gold standard. So ADHD, if we had a group at one time years ago that did ADHD testing and basically did every kind of test except interviewing the patient. So it was really expensive, and patients that obviously had ADHD would come to me and other people and say, there's something wrong, but they said, I don't have ADHD. But when you talk to the patient, they had ADHD real clearly. But none of the testing they did was specific to ADHD. So psychological testing is not specific to it unless the tester does an interview and diagnoses it that way. And speech testing, whatever kind of testing it is, it's not going to be diagnostic unless you do that kind of an interview, and look at their life, how things have worked for them over their lifespan. And you want to get it as much as you can from more than one domain. With adults, it's a little bit difficult because we have adults that come in that don't have anyone come in with them because someone else would have had to take off work and everything. So we have to go by. I'll tend to ask, what does your spouse think? Oh, they think I really need some help, And sometimes the spouse will write a note or something like that, or what does your employer think, or and we'll get information that way. We'd like to have it from 2 or 3 different sources, but you don't always get that. But this is a way to start with it at least. And since there is no objective test, the DSM-5, which is the newest diagnostic and statistical manual, is the first one ever to have things that pertain to adults. Okay, it used to be just jumps up and down in line and stuff, won't wait to turn, Adults don't do that usually. They may not wait their turn in line. They may still try to cut, but they're not as obvious about it. Or pushes other children down, things like that, Not going to be as much with adults. So they now have all those same ones for kids, 6 to 12 years old, but now they have some additional descriptors that relate to adults. And so I tried to get it, but it's new and it's still very copyrighted, so I couldn't really give you I used to have a website up here for the DSM-4, which was available online, but this one's not available yet unless you buy the book, which is expensive. So, but each adult with ADHD, just like each child, can look really different. Each adult can look very different. You have a different constellation of symptoms. If you have that ability to hyperfocus in a particular area of your interest, then you may end up being able to focus really well on a few things, but can't do anything with paperwork or with keeping up with your bills or things like that. So you may have trouble with that still, but you may be able to hyper-focus on your one area in your work situation. And there may be other areas you don't like, so you're not going to be able to focus on those without help. And you want to gather information from a few sources, but and really the requirement is significant. This is still there. Significant difficulty in 2 life areas, so like home and work, or home or work and social life. You may do okay at home with the people that know you well and put up with you, but you may not be able to have any friends outside of home, or keep a relationship with a girlfriend, boyfriend, whatever, or even a spouse. So, but if you have significant enough difficulty in one life area, you probably got it. There's some people who will limit their activity so that they don't really have more than one life area that they deal with if it's severe enough, and so they may not meet those criteria for that reason. But if it's really severe in one area, you need to do something about it. And it used to be onset of age. I thought I'd corrected this, but onset before age 7. How many of you remember what it was like when you were age 7? Really well, really clearly. That's the problem. So most people don't remember that early on that well. They might remember some, but not really that well. So they changed this. It's actually age 12. Okay, which is better than age 7. Some people. How many of you remember what it was like for you at age 12? Okay, still not everyone, but a lot more. You got a lot better chance of remembering that. But anyway, at age 12, you may remember what it was like in school, and you might have been forgetful. You might have not been able to read. Typically, if you have ADHD, if you read something that's kind of boring, you will read it. You read every word, but when you're done with a page, it's like, okay, what did I just read? I'm gonna have to go read it again. Or you may read the questions. Like I had a kid the other day, this maybe 12 or 13. He said, and he figured this out on his own. He said, if I read the questions first, and then read the story, I'll do much better. And that's what we recommend. But but if you're having trouble, with reading things, now if it's really interesting, you might be able to read. And for some people that's true, and some people with ADHD, even if it's really interesting, they may not be able to remember it that well. It doesn't soak in. But the reason for the age 12 thing is that if someone has had really good concentration in all areas of their life and really good control, they haven't been impulsive or overactive or anything like that all their life, and at age 30 or age 40 or whatever, they all of a sudden are having distractibility and can't remember things, can't stay focused, then that's probably something else. That's probably related to an illness or some kind of metabolic problem they're having with, can be diabetes or things like that. It could be a stroke if they're older. So or depression can do it. Chemical dependency can do it. So that's just to separate that out. There are 3 diagnostic subtypes, and there's really 4 when you look at the not otherwise specified. But ADD, plain attention deficit disorder, people still use that term. It actually doesn't technically exist as far as this goes. It's still, those people are still the same who have that, but it's ADHD primarily inattentive would be the ADD. ADHD primarily overactive and impulsive is the least common group. Actually, it's about 15% of even kids, and it's even less in adults. And then mixed type is where you may have overactivity at times and impulsiveness at times, but it's not all the time. And but you do have the inability to concentrate, focus, and organize your memory all the time. And then not otherwise specified is where you have a lot of symptoms. You may even have one area that's really bad, but you don't meet all the criteria. So you still have it. You still need to be treated maybe, but you don't necessarily meet the other criteria. All right. So for adults, a lot of times they only have a feeling of restlessness. They're not physically restless or active, but they feel like, they feel the urge to move around or to think about things or just think really about a lot of things. They don't stop. So mental overactivity can be part of it. They can do fine motor fidgeting, clicking pins, tapping things, bouncing the chair a little bit. Things like that are real common with adults. And it can be intermittent. They may have some days where they do that, some days where they don't. So it's not all the time. Why would someone not be picked up until they're adults? That's a common question. In fact, when they came out with the requirement that age 7, you had to have some symptoms present at age 7. You don't have to be diagnosed by age 7, okay? But when they came out with that, a lot of people said, well, if you're diagnosed as adults, that doesn't even make any sense because you can't have it if you don't have it by the time you're 7. Well, you have it, but you're not picked up. Why wouldn't you be picked up? Well, if it's predominantly inattentive, this is particularly true of younger girls, who in class, girls tend to be a little more approval seeking from the teacher. So they'll sit in class and do like this and smile and nod at the teacher like they know what's going on. The teacher calls on them and they have no idea what the teacher's been saying, okay? And, but it's not really obvious. Whereas the kid who is I used to substitute between semesters, and the first class I had with 35 hyperactive kids, mostly boys, and they were all over the classroom. I mean, the teacher had a Jergens bottle, plastic Jergens bottle that she would throw at him, which I didn't know that at first. It was on the desk. She left it there. They said, "Throw it at him, mister, throw it at him." When someone misbehaved, the previous teacher would throw the Jergens bottle at him. And it was all scuffed up when I looked at it a little more closely. But those guys, you notice right away because they're very active. They're not going to be the smiling, nodding kids, And so that's going to be a difference, and they may not be picked up especially for girls are more often missed than boys, but boys can be too. And then if they've had a very supportive, high-functioning family, very, the family can make a huge difference. The family's very structured. They come home, they do their homework, they do this, they don't let them do anything else, distracting, they keep everything quiet. The family can make a big difference. If they're very high achievers, the family, wants them to achieve, well, and will encourage that in a lot of different ways, and they'll end up wanting to do better and, things like that. Whereas if everyone in the family is chaotic, then they may not end up being able to perform that well, and it'll become symptomatic much earlier. Now, the other reason is what I mentioned when I taught medical school is the increasing demand. So sometimes in late high school, college, but a lot of times in your career, I've seen a lot of people go, for instance, to the plants. They're an operator or whatever, and they do really well. They're in a routine and everything. They get promoted to be a supervisor over a lot of other people. Then what do supervisors have to do? Paperwork. Yes. And it just about kills them. And so it becomes very symptomatic because they're just not going to be able to do paperwork very well.
That's what my husband's at right now.
Yeah. So some of those who really, if you look back, they had trouble in high school, they had trouble in middle school and elementary all along, but they were able to get by because they were real motivated and everything. But then when they're deluged with paperwork, it's just excruciating for them. If they have a higher IQ, that can be part of it. Some people are just listener on the move. They can listen. It's not that much of a problem. They have a wider or a larger box. They can organize things in the box a little bit, in the cardboard box, without having the file cabinet system. But at some point, they'll reach a point where they can't just listen and they can't just handle it by the usual means. They have to really buckle down and focus and learn really intensely, and they can't do that part. So that can happen in high school, or it can happen in college. It can happen anywhere along the way. It can even happen in medical school or law school or in your career, and so anywhere along the way that can happen. If they're very highly motivated, it also helps. And if some people have more determination, we call it stubbornness sometimes, but some people have more of that determination gene. I haven't really seen it where they found that particular gene yet, but I know it exists because it runs in certain families, including mine. And if they have that determination characteristic, they may push really hard. I've seen some kids who will just study from the time they get home to the time, go to bed late, still studying, because they're trying to overcome the problem with it. It has its cost, though. Eventually, they'll get really burned out, frustrated, and eventually get depressed or anxious. Anxiety is one of the ways we see ADHD, and depression is one of the ways we see ADHD show up in adults. because that's, you can only use up all your emotional energy to deal with the difficulty concentrating for so long before you start running a deficit, and we'll talk about that a little bit more too. Now, these are all other things that can be, you can have other psychiatric disorders like obsessive compulsive disorder, depression, anxiety disorders as a separate entity. Vision problems, hearing problems, substance abuse problems, they can all be a part of it. So what happens if you don't treat ADHD, if you were untreated? What are your risks? And this is a kind of an old slide, but it hasn't. There's been new research, but it hasn't really changed much. It's really about the same. The risks. You see, there's more risk in almost every area of life. Teen pregnancy is about 25 times the risk if someone doesn't have ADHD. If they're treated, it goes to almost nothing over the general population, but if they're not treated, it's really high. School and occupational success, it's really rough. Lower socioeconomic status, they tend not to do as well. And there are those exceptions, but there are really exceptions. And then there's substance abuse risk is anywhere from 2 times to 8 times the risk. And I think it's more than 2 times. I think it's probably somewhere more closer to 6 or 8 times the risk for the general population. They will start earlier and they're less likely to quit. We've shown that with cigarettes, alcohol, and other things. And then families are much more likely to end a divorce, and employers, I had one patient who was seeking treatment for his daughter. He had been in the same plant with his 115 employees. He'd been there for 9 years, was still at the absolute lowest position. They liked him, they kept him around, but they didn't see him as reliable. In evaluating his daughter, he said, he came to me afterward and he said, I have all the same symptoms. And I said, how'd you, so, I said, we'll come back and we'll talk about you. And he did, and he met all the criteria for ADHD. And we treated him, and within 6 months, he was the second to the top person at the plant. He just, they just didn't see him as reliable, So once he got treated, it was much better, and it improved quite a bit. And, these are all things we just mentioned. A lot of people at the plants, too, when they go to meetings, they may have, or anyone really, go to organizational meetings, or, the boss wants to meet with you and everything. And they're sitting there and they're trying to listen, but they really are having a hard time putting it all, taking it all in and remembering what they heard. And then impulsiveness. I had one patient, adult patient, who worked at a bank, and he kept on saying things that offended clients. So he got fired. So once he got treated, he was able to work at a bank again, not immediately because he burned a bridge there, but he was eventually able to work in that kind of situation again, but it took a while to get back there. So that impulsiveness can be a really big problem for adults. And then trouble with relationships. Can't remember what your wife said. That can be rough, because especially when you're supposed to go somewhere with them, they tell you about it and you're not ready to go, or you make other plans. Not good. Parenting, that's really difficult with your spouse. Not following the conversations. If there's a TV on and it's right behind your spouse, can't look at your spouse and follow what they're saying, because the TV's, you can't filter out the TV. That can be really tough. And just like teenagers, they can't not play the video game, or not. Now it's the iPad game. They cannot avoid playing the Candy Crush, whatever it is, word games, lines, circles, whatever those games are. They'll play them all day long because they can't not do it. They're just, it's very difficult to take themselves away from it. They don't remember birthdays, anniversaries, and things like that, because that's working memory. That's a little pin on the little sticky note on the bulletin board, but the bulletin board's obscured by everything else. So they tend not to do that. And then even with intimate times, having sex, they can't stay focused on that. So in the middle of it, they'll say, I forgot to bring such and such, And that is a really difficult situation for them to be in, so it's really tough. and it really affects every area of marriage. And then, you know, texting or driving accidents is not just texting. It's there anyway. I think I had a friend in college who had it. He reached down for his for something with his tape player, 8-track, I think, back then. But anyway, reached down on the floor and ran into a truck and was killed. You know, and I didn't. It was a friend, but not that close. So I don't really know if he had all the symptoms of ADHD, but that would be a classic thing to happen. Had one patient, this one, some of you have heard this story before, but one patient driving down to Cameron, where he's from, and 17 years old, 16 years old, opened up a sandwich at this long straightaway. It's about 7 miles, where Highway 14 turns off in the middle of it, and looked in the sandwich and opened it up right as he began going south, and he ran into someone at the end of that straightaway, the very end of it, who was right in front of him. He ran into the back of them because he was going a little bit faster than they were. They had turned on the road way before they saw him coming, and he was going a little faster than them, so he ran into the back of them. That's how long, for 7 miles or 6 miles, he hadn't looked up from his sandwich. He'd stayed on the road by peripheral vision, I guess, but he hadn't really looked up. You know, so that's how long it can go, and that's really dangerous. So it is a very dangerous thing. Having distractions in the car, that can be tough too. This is one we talked about already. But other things too can give you ADHD-like symptoms. Again, you know, dementia can do things like that in much older individuals. But things like bipolar disorder, substance abuse disorders, anxiety disorders, obsessive-compulsive disorders. Obsessive-compulsive disorder does it by you've got so many things going on in your mind, you're using up all your working memory because these things that you can't get off your mind keep circulating around, and you don't have much brain space to deal with much, you know, or to remember things or to, you know, to stay focused. So that can be a hidden one sometimes, but depression itself can cause what looks like ADHD, but when you treat the depression, it goes away. You know, ADHD is not going to go away when you treat depression. It may get a little bit better, but it's not going to go away. Bipolar disorder can look very much like it because in the manic phase, the brain's going so fast that it can't really stay focused on anything, and they may not remember that much either. And then substance use disorders actually cause some brain dysfunction, you know, that might affect the ADHD areas too. There's no routine laboratory testing. I've had patients get brain mapping and different things like that. That's not really, with EEG brain mapping, that's really not considered diagnostic at all. It's very expensive. They tell them to go find someone to treat them once they get a diagnosis, but it's really doesn't make the diagnosis at all. And I've had patients spend like $15,000 or $20,000 on that, and they tell them, they come up with nice pictures, they don't mean anything, but if I could live with myself, it would be a nice, easy way to make money, but I wouldn't want to do that. Computerized tests of attention can be helpful, but they're really not diagnostic either. And then the laboratory testing would only be, there's a very few people that will have, and they're all in the same family in New Jersey, that have a thyroid condition that causes ADHD-like syndrome, but it's not, we haven't found it in other parts of the country. It's just in that particular family. So if you belong to that family, you probably know about it already, and if you don't, it's not going to be anything that you'd need. But regular thyroid problems, if you have hyperthyroidism, it makes you look a little bit manic, and that can give you some symptoms kind of like ADHD too. So this is the only new diagnostic test. It's the NEBA test. The NEBA is just the company that made it, and it's a brainwave test that is approved by the FDA for diagnosing ADHD. This test actually was tested by, you know, the comparison was by having people who are experts in ADHD evaluate the same patients and come up with a consensus diagnosis, and versus someone who is, the first person who diagnosed it was not someone who specialized in ADHD, and then they added the test, and they compared that to a specialist in ADHD who sees it all the time, doing an evaluation, and there was about 13% more had the right diagnosis by doing that. So it's not really that much of an improvement. And if you happen to be someone that sees it all the time, it's probably not an improvement at all. It's more. So we're not really sure. It's only been out for about 6 months or so, maybe about 6 months. So it's not really. We don't know yet how that's going to fit in. It doesn't seem to be that useful yet. It's probably going to be about $400 or $500 to do the test. The equipment's probably really expensive. It's brainwave equipment, which you could have at a hospital. It's just the software to actually read it would have to be purchased. So it's going to be something that I'm not sure how helpful that's going to be. But it is the first thing we have, and some of the imaging that we may get in the future, like functional MRI with a proper software to read it, would be helpful, because the machine uses any MRI machine. That doesn't matter. So, and we have those all over the place. So, but there's not at this point a way to do it, to get an objective ADHD diagnosis. On the other hand, all of the methods that we've used confirm that our gold standard of a diagnostic interview, looking at the patient's history, getting it from several sources if we can, is very accurate. So we don't miss that diagnosis very much. All right. Now, non-medical treatment, looking at what we can do for it. There's lots of things we can do, and a lot of adults figure this out for themselves. But some of the treatment is, using daily planners, making lists, alarms or PDAs on cell phones. So you have your smartphone that's going to give you, if you program it, and you've got to do that, it can actually give you an alert, and they'll pop up and say, like I did one way back that popped up, it was right 5 minutes before. Like if I'd forgotten this was going to happen, 5 minutes before wouldn't help too much, but I haven't figured out how to move it forward. But in my Outlook, it popped up and said ADHD talk, But 5 minutes before, that wouldn't have been helpful. But so you have that kind of thing, though. You can do that, if someone has to take medicine in the mid-afternoon, they can program that into their smartphone. If they have to pick up kids at basketball this evening, there's one that patients have told me about called COZI, C-O-Z-I. I meant to put that in the slide. I just heard about it last week. I downloaded it, and COZI Family Planner, I think is what it's called. And you can put like trash day. You can put as many, I think 5 or 7 phones you can connect to, and it'll send that message to everyone in the family that Monday's trash day or Tuesday or whatever it is. It'll also, you can put family reunion on the 15th or whatever, and it'll be on everyone's phone, So you can tell them how early you want it to remind them and things like that. So that's a really helpful thing. Those kinds of things can really make life a lot better, but it's all functioning as external, concentration or external control. A couple of principles, office assistants and things like that can also help, but I don't really have one that's I used to, but when I was in my private office, but at the residency program we share office assistants, so I don't really have one person who's dedicated to keeping me where I need to be. Just do it principle is if you have a task to do, do it now. If you say to yourself, okay, I'll do it later, and if you don't do a reminder, then it's not going to happen probably. You probably won't get a reminder internally. So if you don't have some kind of external reminder with a PDA or on your computer or something, then it probably won't happen. And Ohio principle is only handle it once. So if you go through papers and you say, okay, I'm going to do this, I'm going to file this later, I'll do this later. When you're all done, you run out of time, and you have to put them all back together again, and then the next time you have to go through them all again. And but the next time the paper stack is much taller, so you want to watch that. Coaching and support groups can be really helpful. I really don't know. Does anyone know if there's coaches in this area? There were a couple, and I haven't heard anything about them in a while. But there are coaches in larger cities sometimes that are you have to pay them to coach you, but that can be helpful, and they can help you reorganize your life. They're kind of like efficiency experts. They'll
life coach. They call them.
What's that?
I see it on TV.
Well, they're life coaches too for people even who don't have ADHD. They're just, I don't know, whatever.
Rich people.
Yeah, but for people with ADHD, coaching them on how to, if you're going to bring something from the home to the office, as soon as you think of it, you go put it in your truck or car. Okay, that's kind of thing they'll look at all those things and say, this is what the routine you have to get into. And they'll help you get into it, and then you probably won't need them anymore, maybe. Cognitive behavioral therapy is another one, and I spoke to a friend of mine who does that, and they're going to try to have some more people trained in that in this area, because I think there are only a couple now that really do cognitive behavioral therapy. But that's a type of therapy that is a little bit, I can't give you a description real easily, but it's basically analyzing the situation and coming up with a plan, and it's not feelings-based, it's not emotions-based or anything like that, and it's not, it could be related to it, but it's really more practical thing that you can teach people to do. There are some cognitive behavioral therapy YouTube videos that are actually kind of interesting. I'm not sure how helpful that would be because it's pretty general, but but that has been shown to be helpful with ADHD. It's not a treatment. It's not the only treatment at all, but it can be helpful to help the sideline issues with ADHD. So there are some supplements that have been shown to help. In my recent research, for the last couple of chapters I wrote, omega-3 fatty acid supplementation has been shown to help focus a little bit. It's not enough to treat ADHD, but it also makes any ADHD treatment you take work better. So that's another helpful thing.
We have 6 and 9.
It has. It should have all the. I put 3. I shouldn't have put 3. Omega fatty acids, because they all have the dexahexanoic and the isahexanoic and all. They have all of them in there, usually. There may be some that are separated. I don't think they're too available though. Okay, but that does help, and it helps the medicines work better. Iron, if your iron is low, can help. Although this is not a huge help, but it may be one more little bit of help. We never take it more than 3 months without getting, without being checked out again. And zinc has been shown to help a little bit too. Zinc and iron have been shown to work in certain neural pathways in the brain that if there's not enough, it doesn't work quite as well, even if you're on medicine. And then medication types and forms, the ones that have worked the best by far, the most robust and helpful, have been stimulants. And stimulant medications have been around for a long time. The ones we use now have been around since 1951 and 1953. Adderall, Vyvanse, and things like that have been, and Dexedrine, those have been around since 1951 in general use. Methylphenidate, which is Ritalin, Concerta, Focalin, all those things have been around since 1953 in different forms. They're very, very short-acting medicines, so the newer forms are much longer acting. The longer acting is much better, because what do people with ADHD have trouble with? They don't remember to take medicine. So your PDA could help you, or your smartphone could help you, but it's easier if you don't have to put that into the mix. If you can take one thing once a day, possibly that would be real helpful. So there's all kinds of different ones. The Concerta was the first true long-acting one. It has a little osmotic pump, so it pumps out for a long time and gives you about 12 hours of help. Quilivant is a new ionic exchange matrix that's soluble that works. I couldn't understand at first how a liquid could possibly be 12-hour duration, because it seems like it would dissolve instantly, but it has a time-limited dissolution.
And which one is that?
That's Quilivant. That's this one right here. Now, it's still pretty expensive because it's the newest thing that we have. And then, but it requires taking a liquid, which most people don't want to take, but there may be some where it finds out.
In some magazines, they advertise it.
Right. And then the diffusion beaded systems are the older ones. They last about 8 hours. Immediate release is 4 hours. Dexmethylphenidate just has the D form, which is the active form. The L form is in all the others, too, with the D form, but it doesn't really do that much. But some people have more side effects with one or the other, and it's just a matter of trial and error in a way, to see which one's going to work the best for a particular individual. The really old one, this wax matrix, it takes about 4 hours to kick in, may last about 4 hours. It's supposed to last 8 hours, but it really doesn't, as far as I can tell for most people. Dextroamphetamine and mixed amphetamine salts are the other ones, and the other type, and there's only 2 main types, and they all belong to one or the other, but most of them are going to be 4 or 8 hours, except for the, let's see, actually I don't have Vyvanse on here. I think I hid the slide that's right after this had Vyvanse on it. But Vyvanse is a prodrug, so the body breaks it down over time, and it delivers the medication over time and allows you to have a very steady level of the medicine. It doesn't work that way for everybody, so we have all kinds of combinations. I keep waiting for the one medicine that's going to work for everybody that I won't have to think anymore. It's not going to happen, I don't think. Yeah.
What about people? Because older people are running into this. Adults,
Right.
high blood pressure.
Right. The ADHD medicines, if your blood pressure is controlled, it's not a contraindication to ADHD medicines. Now, most of the internists have not been trained, and a lot of the family medicine doctors too have not been trained, especially if they came through a long time ago, in treating adult ADHD because we didn't think it existed. You know, so it takes some. You may have to educate your doctor if you don't have, if you're in a small area where there aren't many doctors and they've been around for a long time. But high blood pressure is not a problem if it's controlled. If you start these medicines at a really high dose, then you will see your blood pressure and your heart rate go up. If you start them low and work your way up gradually, because it only takes a few days to get used to each dose if you start low enough. So you build up to the lowest dose that works really well and doesn't give you side effects. You usually don't have much startup side effects. That's usually a startup side effect. So someone that's used to their medicine, they might have 1 beat or so is kind of the average per minute of their heart rate, and about 1 or 2 millimeters of their blood pressure may increase. That's not going to be enough to do anything negative to you. But if you one of the things that we see still, not so much with adults because they know better, but with kids, some people are still giving them medicine only 5 days a week. And on Monday, Tuesday, Wednesday, and probably Thursday, they'll still have startup side effects of nausea, stomach cramps, headaches, and stuff like that, and just not feel good, maybe overfocus. And then by Friday, they get kind of used to it, and then they stop it on the weekend again. They start all over the next week and don't feel good about it. So you want to, the more consistently you take it, you're not going to have those kind of startup side effects. If you don't have much to do on the weekend and you really don't want to take it, just take half of it, and you won't. Or for older kids too that don't want to take it, just get them to take half of it, negotiate with them, and they'll feel much better the whole next week. Eat better, everything's better. Yeah, in the summer we really recommend taking it. More kids die in the summer and on holidays than any other time of accidents. So for kids, we definitely recommend it. For adults, the biggest cause of death for adults in ADHD that I've seen, and it's been in the literature too, is traffic accidents. You don't want to be off of it, you know, because that's, you know, adults have a lethal weapon, and older kids too that drive, you know, have a lethal weapon at their disposal, and so it's really important to have that in effect when you're driving in general. Now, there are non-stimulant medications too. Atomoxetine, which is Strattera, is the only non-stimulant that's specifically for ADHD for the concentration part of things in adults. It's approved for adults. The two that you're seeing, Intuniv and Capvey, that are approved for ADHD, but they only go up to age 17, and I haven't seen anyone get it approved by insurance for older than 17. But they only help with overactivity and impulsiveness, and that's not really the most common thing that adults need. Now, atomoxetine looked really good when it first came out. It does work well for some, but it's a really small percentage. I think I'm guessing somewhere around 30% of my patients, because I tried to make it work when it first came out, because a lot of people didn't want to take stimulants. But it's really not that helpful, and usually not by itself if it is. So someone that's doing really well, but I have a few adults that have not done well with stimulants, and they've done well with this. If they don't do well with stimulants, they've got a better chance of this working, okay? But some of them who are doing almost okay, kind of close to being really good, sometimes if we add the Strattera, it'll make up the difference and it'll do really well. So in combination, it's much better. It seems to be by itself not as well in general. Could be good, but not a high percentage. Bupropion, which is Wellbutrin, that can help too. It has a little bit of the dopamine effect that the others have, but it's not very strong. So for most adults, it's probably not going to work that well. I have one, 16-year-old heart transplant patient that they didn't want him on stimulants for a while. He's been on Wellbutrin. It was relatively mild to begin with. He's done fine with it, but it's still a struggle, but it helps him somewhat, so he's able to do better. Tofranil is one or imipramine is one that we used to use a long time ago for adults, or desipramine is another one that's closely related, and it works for 30% also. It's kind of like atomoxetine has a lot of side effects. We don't usually do it. Clonidine and guanfacine can help with sleeping. And Buspar has been reported, but Buspar seems to have a really low percentage of people who respond to that. But when we get to where someone's tried everything, then we may think of that, but probably not going to be that great. So dosages, I'm not going to go too much into this, but except to say the maximums are controversial. They're not too controversial for me, but there are people who stick to the FDA approval, which the FDA always, when someone seeks approval of a medicine through the FDA, they always have very low doses because they don't want to chance any side effects that'll make them have to scrap this medicine altogether. So once it's approved, then people do what's called empiric research, secondary study, which is not funded by not overseen by the FDA. The FDA has so many legal restrictions on their research that it becomes less than unbiased. It's kind of it's not as accurate all the time. So when the when your other researchers who are real, they don't have a financial stake in it at all, one way or the other, or do the research, then you'll see more see a medication used in different ways, more different doses, and they'll try to do studies on different doses, and you can actually find much better the dose that that is probably a more accurate range. So the maximums, what the general thing is, the general recommendation is by the Child and Adolescent Psychiatry group is and the American Academy of Pediatrics for younger patients is to titrate up to the dose that works without intolerable side effects. So you basically, ADHD is not a benign condition, even for adults, because traffic accidents are so dangerous. If you don't drive, it's probably not as bad, but it's not a benign condition. So you want to titrate up to where it works really well, but doesn't have intolerable side effects. And if you get to intolerable side effects, even if it's working well, you're going to have to scrap it and go to something else. But if if you don't reach either intolerable side effects or it's not working, then you haven't really gone up enough to see what dose would work. All right. And equivalency is kind of difficult sometimes. This is the Vyvanse slides. They were kind of out of place. But I'm going to go to what do you do if you want to see a doctor for this? Your first visit, you should it's really helpful for a lot of them to bring in the online questionnaire that you've done and print it out, because especially if they're not really very used to seeing adult patients with ADHD, it might help. You can have a family member, employee, or friend. I know it's kind of tough to do that sometimes, but that could help out. And then write down your symptoms and things that are causing the problems, that are causing you problems with it, and that'll also help them to know how much difficulty you're having with it. We'll have patients come in and say, my employer is about to let me go unless I do something about my concentration, because I'm just not being productive, and they're having to go behind me and double check everything because I'm not reliable. So we'll get that kind of situation. We know that we've got to do something about it. So those are things you can bring in. A lot of physicians are really afraid that you're a drug addict, because what went around when I was in medical school is these medications are really addictive. Everything. I'm certified in addiction medicine also, and I really have never seen that. I've seen people neurotically think they're addicted to things like sometimes this, but also things that are like Tylenol or other things. But I mean, it's not really a true addiction that we've seen.
Well, my boys took it forever, and they don't.
Right.
They weren't addicted.
Yeah. So I have some case studies, but I think we'll stop there and just let you ask questions.